Now, this has been a big story on the front cover of the Daily Mail. 5 newborn babies have died in a spiralling whooping cough outbreak, which has terrified parents.
Almost 3,000 cases have already been recorded in 2024, triple the levels seen across the entirety of 2023. And the ever-growing outbreak is on track to be the biggest in over a decade.
I know, it's very worrying. Well, joining us now is Health and Social Affairs editor of the Sunday Express, Lucy Johnston. Lucy, thank you for joining us. What are they putting down this particular outbreak to?
Well, various experts have various theories, and it's not entirely clear, but there are some very clear problems that we've seen a declining in vaccination rates during the pandemic lockdowns. That is partly due to access problems. It was difficult to get to see your GP and bring children in, number of children in to get vaccinations. There was also fear-based messaging during that time, so maybe people were afraid of going out and about and going to visit their GPs. People were very afraid of catching COVID. And also the lockdowns themselves created a sort of what they call an immune deficit. So people weren't mixing as much, and various diseases, your immunity works on the go. And if you're not picking up infections, then you're not producing immunity to it. So that saw increases in another problem with children, other respiratory problems.
Can I just quickly ask, do we know whether these babies were vaccinated against it?
Well, these babies actually were too young to be vaccinated, right. But there is a maternal vaccination programme, and the number of pregnant women who, so the antibodies, the immunity is passed from the pregnant women to the babies. And so there's a programme for pregnant women to be vaccinated. And that's dropped from about 70% in 2017 to about 58% last year. So vaccination rates were already dropping before the COVID-19 pandemic. So it's not just because of that. But what we've seen in both children and adults is a drop. That drop actually it drifted down further, and there was less people getting vaccinated overall, which happened with other vaccines too. We've seen an increase in measles recently, haven't we? Which has taken public health authorities an urgent catch-up for children to be boosted with the measles, mumps and rubella vaccine, because we've seen deadly measles on the rise too.
Lucy, is it not the case that, very interesting points, by the way, saying that the vaccination rates for whooping cough were going down before COVID, because I had a theory, and I've had first-hand experience from friends of parents of young children who just refused to get their kids vaccinated with traditional childhood jabs because all trust from the health establishment has just been blown apart after COVID. Arguably there were many lies told, there were mistruths, information was spun, and it's not just COVID either. We had the infected blood inquiry finishing next week. The role of the pharmaceutical companies there. General trust, I think, in pharmaceutical companies, the health establishment, the NHS, doctors, as far as I can tell, since COVID, has just been completely trashed.
Trust in public health is crucial. And during COVID, we had very confusing messages about the need to stay at home. People were silenced. And there was a whole confusion over the COVID vaccine for children, with the government's body that recommends vaccines saying it didn't recommend COVID vaccines for children. And then the chief medical officer saying that they should have it anyway, and a big push for children to have that vaccine. And as we've just seen, the AstraZeneca vaccine, COVID vaccine, has now been withdrawn. So public health should be about education, support, and guidance. It should be about advice, and it should
Lucy, thank you so much.
Along with you. But it was about fear-based messaging and a big push, and I think that has had an effect.